Hello everyone. Today, we're diving into the world of a medication called Flutamide, commonly known by its brand names, Eulexin. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Flutamide, often recognized by its brand name Eulexin, is an oral tablet that falls under the category of nonsteroidal antiandrogens. Its primary function is to block the action of androgens, male hormones, in the body, which can help slow the growth of certain types of prostate cancer. Initially approved by the FDA in 1989, Flutamide is primarily prescribed in combination with other medications for the treatment of metastatic prostate cancer. This combination therapy often includes an LHRH, luteinizing hormone-releasing hormone, agonist, which helps reduce the amount of testosterone produced by the body. Flutamide is effective in reducing the size and spread of prostate tumors and is used to manage symptoms associated with prostate cancer. Warnings: Flutamide comes with its set of precautions. It's not intended for use in women or children. One of the significant risks associated with Flutamide is liver toxicity, which can be severe and even life-threatening. Patients should undergo regular liver function tests before and during treatment. Additionally, Flutamide can cause serious respiratory issues, including interstitial lung disease. It's crucial to monitor for symptoms such as shortness of breath, cough, or fever. Patients with a history of liver disease or respiratory issues should exercise caution and discuss their medical history with their healthcare provider. Before taking this medicine. Before starting Flutamide, several factors need consideration. It's essential to inform your healthcare provider if you're allergic to the drug or any of its ingredients. Given its impact on the liver, those with liver diseases or conditions should discuss potential risks and benefits with their doctor. If you're scheduled for surgery or any medical procedure, inform your healthcare provider about taking Flutamide. You should not take Flutamide if you have severe liver disease or a history of severe allergic reactions to similar medications. It's also not recommended for those with certain genetic disorders affecting the liver, such as Gilbert's syndrome. Before starting the medication, inform your doctor if you have ever had heart problems, liver problems, respiratory issues, or any other medical conditions. It's also essential to let your healthcare provider know if you drink alcohol very often or have a history of alcohol abuse, as this can increase the risk of liver damage. Side effects: All medications can have side effects, and Flutamide is no exception. Some individuals might experience gastrointestinal issues such as nausea, vomiting, diarrhea, or abdominal pain. There's also a potential for gynecomastia, enlarged breasts, and breast tenderness in men. It's essential to be aware of these potential side effects and consult your doctor if you experience any unusual symptoms. Additionally, there's a risk of serious liver damage, which can manifest as yellowing of the skin or eyes, jaundice, dark urine, severe fatigue, loss of appetite, or pain in the upper right part of the abdomen. If you notice any of these signs, seek medical attention immediately. Another potential side effect is the onset of respiratory issues, including interstitial lung disease. Symptoms can include cough, difficulty breathing, and fever. If you experience any of these symptoms, it's crucial to get medical help right away. Furthermore, Flutamide may cause serious side effects including hot flashes, decreased libido, impotence, and an increased risk of blood clotting disorders. It's also important to note that Flutamide can lead to changes in blood sugar levels, which can be a concern for patients with diabetes. Symptoms of liver damage include nausea, tiredness, vomiting, trouble breathing, and abdominal pain. Always consult your doctor for medical advice about side effects and report any new or unusual symptoms. Interactions: Flutamide might interact with other medications. It's of utmost importance to inform your doctor about all medications, supplements, and herbal products you're currently taking to avoid any adverse interactions. Specifically, Flutamide can interact with blood thinners, like warfarin, increasing the risk of bleeding. It can also affect the liver's ability to metabolize other drugs, potentially leading to increased side effects or reduced efficacy of those medications. Dosage: Correct dosage is vital for the effectiveness of any medication. Always adhere to your doctor's recommendations when taking Flutamide. Regular monitoring and periodic checkups can help ensure the drug's efficacy and safety. The recommended dose of Flutamide for most adults with metastatic prostate cancer is 250 mg taken 3 times daily, approximately every 8 hours. It's usually taken in combination with an LHRH agonist to enhance its effectiveness. Always ensure you're taking the correct dose and never alter your dosage without consulting your healthcare provider. Avoid. While on flutamide, it's advisable to avoid excessive alcohol consumption to prevent liver damage. Given the potential for dizziness, it's wise to rise slowly from sitting or lying positions. As with many medications, it's recommended to avoid activities that require full alertness, such as driving or operating heavy machinery, until you know how flutamide affects you. FAQ. Many wonder about the age restrictions for flutamide. Currently, its safety and effectiveness in individuals younger than 18 are not well established. It's always best to consult with a healthcare provider for any specific queries related to this medication. Additionally, flutamide is not intended for use in women, particularly pregnant or breastfeeding women, due to the potential risks to the fetus or nursing infant. Closing. That wraps up our overview of flutamide. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.